Am I making this up? This is real, guys. This is real life. This is real life. So we'll try to get, and then if somebody has a problem that we identify, you know, okay, you have maybe a stomach problem or an ulcer, or I have bad, you know, arthritis, I need to, we'll make appropriate referrals to that particular. So you're not going to be yo-yoed, you're not going to be run around, we'll tell you what it is. There's also something in here, it's a small little needle stick that we check on your fasting liver profile, cholesterol, triglycerides, liver functions, and also if you happen to be on Coumadin, for whatever reason, atrial fibrillation, blood clot, we can do a Coumadin check as well for you, and it's included in that package. Can you imagine this? I'm talking about just black seed alone, 700 tablets all year round. Every day you're going to take 2. You got to get up. You're really going to have this built immunity, and we're trying to let people know there's a whole new approach that make you strong and healthy, and so you don't have to go for this huge costs and really unneeded, you know, because somebody have to pay for this. And if you say somebody, oh, X or Y, you're going to be next. You're going to pay for it no matter what. The system is crashing. There's no question about it. A lot of people are shutting their doors. A lot of people are getting out of business. A lot of you know, guys are being bought out. A lot of, you know, and you've seen it everywhere. So the whole purpose of making this effort to reach out to everybody. If you know anybody from that age group, hey, I heard of an option. I heard of a hope. I heard of a new choice that was never existed before, and this is what we hope to make as a model that will carry on, you know, and give people, you know, good sense back. You know, it's not a jungle, guys. You know, although it seems like it's turning into a jungle, you know, the big shark eats little fish and stuff. We just want to bring good humanity, good values, good heart to people, because it's really sad if we keep on seeing this premiums going up. I can't afford it. I can't afford it, doc. You can't afford the co-payments, can't afford this, can't afford that. But if we have this nice model, you're gonna get sick? Just come. You have 2 appointments. We'll have like a credit card, you know, with the Brooksville Cardiology. You come in, and you know, every time you come, that's, you know, that's included. You know, is in that package. Whatever's in there, we honor it. And I believe this package is unmatched anywhere in the nation. And it's a beautiful thing because I want everybody to know that there are actually people who care about delivering good care and medicine the old-fashioned way. What happened 50 years ago, before CAT scans and MRIs and all that, you know? I think there's a whole overuse of these things. We still can do the old-fashioned way. You know, basically a clinical diagnosis by good history and good physical exam. And by these simple things that doesn't cost much, we can get about 85% of the question answered. Yes, there will be some testing needed, but it's not as like, you know, the first knee-jerk reflex is order all this, you know, expensive tests, because the system will not be able to afford it, folks. 1 out of 5 Americans have no food. 60 million Americans have no food. You know, all these artificial problems, like, you know, 70 million Americans have no access to decent health care. All these problems because there's a lot of greed and a lot of fraud. So although we cannot address all this issue at once, although we have upssnow.com, this is a separate issue altogether to address these issues. We want everybody to know if that's what you strive to accomplish, we have a whole new model for you that you may want to take advantage of. It's not for everybody, but it's there for those who think it may fit them. Okay, so Doc, you sound like a real nice guy, and you're just giving me the song and dance, right? This is New York talking, right? You know, I'm trained in Brooklyn and you know, the tough neighborhoods. You give me the song and dance. What is the bottom line here? So, bottom line is, if you ever need to go to the hospital because of, God forbid, a motor vehicle accident or something bad, you may want to use like a catastrophic insurance that may cover that particular need if it arises. But in the meantime, we're going to keep everybody healthy, stress-free. No need to have all these exuberant costs and so on. And Feeling good? Doc, I actually feel good. So we'll save at least about 50% or better, and you'll have a better quality. And no games. We don't play games in Brooksville Cardiology. We actually care about the patient. We actually want to help everybody. You know, we just want to make sure that the patient know about it, so they will have no middleman and no barriers in between us, between the providers and the patient. And, you know, we want to just do, like I said, the good old medicine the old-fashioned way. And if you go on Brooksville Cardiology website, we're just going to take you for a little tour so everybody gets to see it and kind of share the excitement with whoever didn't have this. This was put in yesterday. And, you know, if you click on the radio show, I don't know if the sandwich will see it. This sounds familiar? I know. We have Bob Penrod. I'd like to get the blood flowing before we start the interview. What I'm saying to you is that we have almost you know, one hour interview in here, so you can listen to it talking about the same thing. You know, and if we go up, if you go on the left side, you go into the Your Heart Matters. This is a new blog that everybody will be like your e-newsletter, and Your Heart Matters. That's the name of the blog. To get your information and to go into really find out what you need to know, and we'll make this a very nice and inspirational and informational and interactive blog that people can log on, and we'll have everybody kind of emailed their message to. So Your Heart Matters. That's our new blog, and I would urge everybody to take advantage of that. If you go into our services, we will be able to let you know that this is our 25 services. I didn't put here the ECP, which are external counter pulsations, but if somebody needs it, although it happened in a smaller, you know, version of folks that they may need external counter pulsations, they have extensive coronary disease and so on, that could also be covered by that as well. The other things we do, that all this, you know, basically the angioplasty and the stents, that if somebody needs an intervention. And this is what the ECP machine looks like. We're going to go to contact us, and I want you to be able to, you know, in the future, we'll have everybody kind of shoot an email and let us know how they want us to improve services. We'll have a feedback from everything we do based on, you know, the blogs and other input that we get from the patients. We're going to go to the memory lane, and this kind of puts it together. We're Brooksville Cardiology, you know, for the history. This is a picture of the laser beams, and this is in the pyramids at Sound and Light Show. And you know, if you go down, this is downtown Cairo with all the Nile coming. This is one a letter that we got actually in April from our president about the community involvement and so on. That we were displayed proudly just to let people know that this is just not medicine, but it is the whole, you know, concept of community and heart and services that revolve around it. We go down to, you know, this is our previous events of 2009, go down. And every year, obviously, everybody knows that we have a gigantic health fair, and hopefully in 2010, we will have our 11th annual health fair. That's usually around the fall. So we'll go back, and just to give you a quick tour of the facility, so that we will have actually a quick few seconds here. This is the best guy in town, so he helped me. He's my brains. So give him a big hand, Ahmed. And his dad was just here. When he comes in, we'll recognize the dad's contribution to his son. So, look familiar to some of you guys? Okay. Talking about the pyramids, we'll bring home. Let me tell you how the world is getting too small, as a matter of fact. You want to go on home, and I'm going to show you, very nicely. We had, a picture actually now with the program that's happening. Let's go pre-register. So for the convenience of folks at home, they can actually go on and they can go a new patient form. If anybody wants to be affiliated with Brooksville Cardiology, they can go and log in, and they can have this downloaded and printed out in a printer, and they can fill out the form so they don't have to waste half an hour or 45 minutes in the waiting room. Let me just show that to them so that they can get a feel for it. So you can, fill this out at home and so on and so on. You bring it typed and written. So that saves us all this time and the aggravation sometimes. Who's this, who's that, and So this is a convenience to a lot of patients, especially if they're going to be newly established in the practice. I'm going to mention a few things about our practice. You go up. Second one. Okay, good. So this is you can click on the first, there's two big certificates everybody should be aware. This is national certificates, that's a big deal. And we're nationally certified in both the echocardiogram, accredited. This stamp is a very, very important one. That tells that I can help. That's a quality lab, and as only, not every lab in the United States is certified. So this is a big deal. You want to see the other one, and this is also for the nuclear cardiology for our stress test. This is a quality work as well. Okay, so we'll go in. This is anybody wants to check out. I'm trained and grilled and barbecued in New York City. Just about every borough in New York City. There's drive-by shooting in Brooklyn, mostly in the downstate area, Flatbush, if anybody, So this is all gives you my training, all the hard work years. I got 3 sets of training, about 30 years of schooling put together before, coming and say I'm a cardiologist. So this is kind of put things together in membership on a professional association. And if you go down, there's also all the manuscripts that's published and the journals. So we try to contribute to the science of medicine and cardiovascular medicine through the years. And I was very lucky, and thank God for that, given the opportunity. That was part of the stent research. Way back in the early 90s, way back, we did it in the animal lab. And I remember, everybody knows that, we worked on pigs because that was the closest model that they could bring. And, I had to go home and scrub myself 2 hours just to get rid of the smell. So anyway, all I'm trying to tell you that all this it didn't happen overnight. This is sweat, tears, and blood over the years. And we come, a long way to be able to serve our patients, do them justice, and prevention. That's the way.